Hi, I'm Will Orr. I'm Urgent Care Group Director at the Royal Berks, and I've been working with the team on trying to get ready for this winter. And we want to talk a little bit about what people can do to give themselves the best chance of enjoying good health across the winter period. And I guess we're all thinking about that particularly at the moment because the weather's really got cold just now. There are lots of things that we can all do. Very important for people who are at risk to get organised and get their flu jab if they haven't had that already done. And many people will know whether they're in an at-risk group or not and whether they should be having that. If they're not sure, then there's information on our website here about whether you should be pushing to get the flu jab or not. But actually protecting yourself against the flu is a really important thing, and protecting others from catching it from you as well. We need to encourage people to be really careful about keeping warm this weather this winter when the weather's as it is. A lot of people, particularly the elderly, worry about the cost of heating and often keep their houses colder than is really ideal for them from a health perspective. And that's a really, really difficult challenge, but people can compensate for that by wearing the right kind of clothes, by wearing lots of layers, by moving around the house on a regular basis, maybe keeping to one room and keeping that room warmer and more snug, by drinking lots of hot drinks, making sure that they feed themselves well and they have hot meals. And it may be that you know someone who's going to struggle with that this winter, and that there's a chance for you to help them and make sure that they're better able to do that, particularly when the weather's really harsh. For a lot of people, they're prone to getting colds over the winter period, not necessarily flu, but making sure that they've got simple cold and cold remedies, paracetamol, just the kind of thing that you can really buy over the counter and that can make a difference to how you feel and perhaps get you up and about and out of bed a bit more quickly if you're feeling like you've got a bug. There are a lot of people who are on important medications, and making sure that they've got their repeat prescriptions sorted out before the Christmas period, before their pharmacies shut, making sure that they don't run out of medicines. Perhaps surprisingly, that's not an uncommon reason for people ending up coming into hospital over holiday period because they've run out of medicines. So just making sure that perhaps somebody that you know is organised with all of that. And often they can order their medicines online. And I guess the other thing really is that we all know or live nearby more elderly, perhaps vulnerable people. And over the Christmas period, just think about keeping an eye on people and whether they're looking after themselves, whether they're okay, whether they perhaps need a bit of encouragement to seek a little bit of help, organise a doctor's appointment, get to a hospital appointment, taking early action which might make the difference between them ending up going into hospital as emergency or actually avoiding a crisis like that. And all of that stuff's really important in general terms, but it's also important for us at the hospital because we know that we're going to be really hard pushed this Christmas over this winter period, and trying to keep people well and keep them out of hospital is a really important priority for us. So take care of yourselves.